Do you think they're prepared for the soft skills that are required that you were discussing earlier?
No, I don't think so. I think that many of them, this is their first job.
Mm.
And so all of a sudden, all of the weight of the world is now on their shoulders, not only making financial decisions for a family, justifying diagnostics, justifying treatment, taking on all of the emotion that comes with a family and their pet, their sick pet. And then trying to be the leader in the room. So, if there's staffing drama, if there's not enough staff or not enough resources, how to kind of stand up and weather the storm. And so I do think that a lot of them struggle.
Emergency medicine is where veterinary medicine shows its true colors. It's fast, unpredictable, emotional, and sometimes a little chaotic. And the people who choose to live in that world are a special breed. Today's guest, Dr. Christine Klippen, knows that world inside and out. She's an emergency veterinarian, a diplomat of the American Board of Veterinary Practitioners in Canine and Feline Practice, a mentor to young doctors, and someone who has spent years navigating the moments where medicine, emotion, and real life collide. In this conversation, we're going beyond the scrubs and the ER doors. We're talking about what emergency medicine really feels like, what surprises veterinarians when they enter the profession, why some thrive while others struggle, and what it takes to build a career that actually lasts. Most importantly, we're getting to know Christine, the doctor, the mentor, and the human behind the profession. So let's jump in. Welcome to Irreplaceable Truths. Did you get I sent you the moral injury survey a while
I
back.
did, and I forwarded it to a bunch of people.
Cool. Awesome. Yeah,
Yeah.
it's crazy. I actually put this one because I could hit veterinarians all over the world. I
Yeah.
put it on Facebook, and the response has just been insane. Also on LinkedIn.
Yeah.
Like
No,
people are
I
like,
put it in many of the moms groups.
"Oh, you did?
Yeah, because I'm part of a bunch of moms groups. And so,
Okay, so you got to let me know about these moms groups because I hear such mixed reviews when it comes to these moms groups on Facebook.
yeah.
Where where do you stand on the moms groups?"
So I think that it's a great way for like sharing some of the struggles and stuff that we have as professional women, and managing households and managing clinics and managing employees. I think that's all great. um, I think that my local moms group is fantastic. And there's a lot of helping each other out. They have local CE events and kind of get togethers and just kind of looking out for one another, looking out for one another's clients. I think that they got really big, and there's quite a few of them at this particular point. And so every single little niche that could be a niche is now a niche of a mom's group. Um, I do understand where a lot of the controversy came into play, um, with copywriting things, and all of a sudden people felt betrayed.
Did you
Um,
say when you said copywriting, are you talking about intellectual property or people just taking stuff from other places?
so they attempted to kind of copyright the name Vet Moms.
Mm.
And I don't know if it had to do with like CE and just being able to market things, but a lot of people had some really, really strong opinions associated with it. I have too much other things in my life to get that much into it.
Yeah.
But I can understand why a lot of people had strong feelings. And because I do remember when vet moms initially started, and the people who initially started it, and the mom that started it started essentially a blog on Vin. and she shared these very, very deep, deep struggles that she was having around, raising a child and things like that. And it was heartbreaking to listen to. And she was an emergency doctor and she worked in the middle of the night, and Vin was her outlet, to talk with other vets. So I understand how it came of. And then it got really, really big. And you would think once it gets super, super big that way, something was going to have to happen. So,
It's cheaper than therapy, that's for sure.
Yep.
I'm not saying therapy is a bad thing, but
No, everybody should do therapy.
I know, but yeah, exactly. I 100% agree. But when it comes to a profession that tends to be a little too stubborn and too perfection oriented, it's very hard for you to tell someone that they need to go seek therapy. Yeah.
But I think that's coming from probably backlash of yours and my generation, where going to therapy meant something was wrong.
Well, when I was a kid, they diagnosed me as hyperactive. They made me go to therapy, and they said your kid is hyperactive. Of course, that became ADHD.
Right.
But because I was hyperactive, I was never allowed to have sugar. So don't tell me therapy's all good. There's a lot of things that I missed a lot of birthday cakes and a lot of ice cream because of that. But I made up for it. I'm sure I made up for it in my life, but with other stuff. But I was very fortunate when I was doing my doctorate at Pepperdine, that now therapy is obviously included in tuition. I love it when people say the school offers free therapy. No, it's in the tuition.
Yeah.
But I because I was studying stress and I was studying burnout and I was studying psychological strain, and I thought maybe I should let me do therapy. And I was going to retire because I was fired, but they did give me 6 weeks, and I'm like, I think I need to prepare for this. And it was probably one of the greatest things ever, because it gave me the tools on how to cope with the 4 months that I was going to face after I was done working.
Yeah.
And I warned my wife too. I'm like, okay, honey, this is what's going to happen. They told me this is going to happen. So it also gave my wife a little bit of warning. So she also had the tools in order to deal with my craziness, as if I'm not nuts enough. But she's a saint. She's put up with me for 30 years. So she's an absolute saint. But, it definitely helps. It is definitely a helper. So
Yeah. No, I think when I start working with new grads in general, I am always, hey, therapy is a good thing. It doesn't mean anything is wrong or broken or whatever. It helps you understand you and how you work. And as you navigate the different just transitions in your life, transition from student to new grad, for myself, once I graduated from, essentially new grad and working, and then trying to be a parent and navigate a young child, and not understanding why I felt like I was going crazy, which he's 11. So we're still, we're still in that scenario.
But the good news is, if you have a boy,
Yeah.
boys always tend to love moms. My daughters never really fight with me. They fight with mom. So the daddy is going to have issues. And as he gets older, he's going to be more and more of a help to you. So don't worry. Yeah, it's hard though. 11's hard, 12's hard. And then hopefully most of the drama for the boys, in my opinion, is usually done. But girls just get wicked mean to each other in high school. So that's a whole different podcast that I could do.
Yeah. I believe that.
So why don't you tell us who was Christine? when she was younger?
So I grew up with a younger brother, and I have my parents. They're still together. My mom is a retired nurse who worked for 45 years. I know, and we owned a couple of family businesses. So working for me was very like I was starting to do it as soon as I was 5, 6 years old. Doing stuff in the store. And we always had pets. One of my favorite stories is my poor dad, bless him. We did not tell him that we adopted a cat, and this cat was a scaredy cat. And so that cat probably lived in the basement for probably 8, 10 months. And one day he was like, "Have we always had an orange cat?" And my mom and I, clutched ourselves and said, "Dad, we have had Scotty for years." Unbeknownst to him, we snuck him in. So
Way to fuck with dad there. Oh my God. Poor guy. I thought he was going crazy. Okay, so we continue.
I know. And so having pets was always a thing. I grew up, I was just going through my my bookcase yesterday because I'm kind of recycling some of my books, and I have the entire James Herriot series, every single one, paperback. I have read them over and over again. They are so dog-eared at this particular point, and that to me was what the goal was. And I wanted to be that, just that level of service and that level. The James Herriot stories really, really influenced me I knew I needed to give something of my life. And what would be serving animals. I mean, that's the noblest cause, in my opinion. So I worked at a vet hospital in high school, went away to school, realized everybody wants to go to vet school. Everybody wants to go to vet school. Didn't get in the first couple of times. Took a couple of side roads in my career into becoming a veterinarian. And then eventually kind of made it back to vet med. And I couldn't be more thankful. I do love the profession.
What were the side careers that you were doing?
So in addition to my my animal science degree, I have a nursing degree. So I didn't know what I was going to do with my life. And I remember calling my mom and saying, I didn't get into vet school. I don't know what to do. What do you do with an animal science degree? And my mom was an instructor for at least 2 or 3 of some well-known nursing schools in her area. And so I did a second bachelor's in nursing. I did some bedside nursing for a short time, a couple of years, and then was like, you know what? I still have that itch that I want to go back to vet school. And so I was like, this is going to be the last time that I'm going to try, and we will see. And I think that it prepared me for vet school. It prepared me for ICU and critical care because, I saw what medicine could do. I saw, how, human healthcare worked, and still be able to show up for patients in general. And so I do think that even though it was a short time working as a registered nurse, it really prepared me for my life as an emergency doctor, but also dealing with people. So.
Wow. There's so much to unpack there. Because well, first off, let me ask you this simple question. Do you believe when it came to being a nurse, that's the closest comparison there is to being a veterinarian? Because my personal argument is that MDs and DVMs are two different beasts.
Yes, I would agree with you. And I come from a family of nurses, and that was always the question, well, why don't you become an MD? And I was like, because I don't have a desire. I feel that there's patient care is removed from being an MD. Whereas I enjoy interacting with people. And I felt that, and believe it or not, you are the first person that's ever actually probably said that DVMs and MDs are not the same. Because I do think that we show up not only for our patients, but we show up for the families as well. And I don't necessarily think that I see that in MDs and human healthcare. I think
Yeah.
our nurses, our NPs, I don't know enough about PAs, but I think that nurses and NPs show up for families in addition to the patient.
Well, in my research, I would always, when I was doing my dissertation, I would always pull nursing papers, because I believe that the emotional labor that's involved in nursing is equal to the emotional labor that we deal with every day in the veterinary profession.
Yeah.
Because, like in a hospital setting, because we work in a hospital, MDs in a hospital, they come in, they spend 5 minutes with the patient, and then they're gone. Where the nurses are there for a 12-hour shift and probably 3 days in a row.
Yeah.
And you get to know the families, you get to know the grandpa, you get to know the kids, you get to know the wife, you get to know everyone who's involved in the family. And that's why I believe compassion fatigue in nurses and in veterinarians are so similar as well.
Mm-hmm.
So, and now I want to go off this James Herriot concept because, there are a lot of veterinarians who are veterinarians because of James Herriot.
Mm-hmm.
I know a lot of veterinarians who bucket list was to go see where James Herriot lived and worked. When you remember James Herriot, because you've read him so many times and you bookmarked it and you ear tagged it, how much is the profession like James Herriot?
Nowadays, not at all. Not at all. And I think that, what a lot of people don't realize about James Herriot is that he suffered from terrible depression. The person who, James Herriot obviously is, there's there's stories, but the person that the stories were around had significant depression to the point where he was hospitalized several times. And so I don't think that the profession looks like that any longer. And I think that there's pros and cons associated with it, because I think that, he gave so much of his time, the middle of the night. I remember stories of, it being 10 degrees out, and all he wanted to do was rectal those cows because his arms were freezing.
I remember that.
Yeah. And so, on one hand, some of that wasn't healthy and probably contributed to why, many of his stories, he really, really struggled with depression and a whole bunch of other things. But on the other side of the coin, he was so selfless. He was so selfless. And he, and I think that sometimes it's just this very, very thin line that we have in our profession where, yes, we want to, these are the reasons what brought people to the profession, but these are also the reasons what drive people away.
So what do you think? Do you think James Herriot would just be another stat in this modern profession? Do you think he'd thrive? Do you think he would have been gone?
I haven't thought about that from that perspective. I think that unfortunately he probably would. I've done this long enough now that I've known enough people who have succumbed to their demons. Some more close to myself than others. And I do think that, you know, I would be concerned that if James Herriot was a veterinarian today and didn't have resources and didn't have people looking out for him, and and if he continued to be in the mixed animal rural America, even if he was here in America, I think that he could have been a statistic.
So, what did the 25-year-old Christine believe this career would be like? Did you think it was going to be James Herriot?
I don't even know. I don't even know at this point. I think
Because
that
you had the history, right? You
yeah.
had the history prior working at vet clinics.
Hmm.
You all those things. I mean, you were able to know what was going to happen, but you were 17, right? You said when you started 17 or 16. So
Yeah.
there's about a 10-year span there when you really got into the profession. Had it changed in that decade?
I think that it did. I think that when I got out and graduated and saw the realities of what vet med was, my first job was in San Antonio, and there is a very, very stark socioeconomic divide between the different communities within San Antonio, and I had never been exposed to that. And so all of a sudden, things that I would never have brought, in my mind, in James Herriot, everybody, wants to do what they can for their pets, and they, even if they're not able to pay for things, they're wanting to barter. And for the most part, there's very few stories where people were angry at us as vets. And I think that that was the biggest surprise, is that people can be very angry with you, and it may not be rational, and there might be other circumstances that are coming to light during those situations. But I think that part I was quite surprised about, jumping in, going, oh my gosh, I thought everybody would love vets. Not everybody
Right.
loves vets.
Yeah, well, which is so crazy because nurses have uh the highest rated profession as far as trust. Nurses are in the 80 percentile range when they survey whoever does those surveys. Veterinarians are second. So do you think it? And they're in the high 70s. So let's say it's 75%. So do you think it's 25% of the people out there that just make this job so difficult, or do you think that number is wrong?
No, I think 25. I think 25% is very reasonable. But the problem is that 25%, because of the way that our brains are wired, I am more likely to going to reflect on those cases that someone was angry or the outcome wasn't good, rather than the 10 that should have made me feel well and should have been great, or if should have had families that said thank you. I think that's just the way our brains are wired.
And you went into emergency medicine. Like you decided, you know what? I know that there's this, there's this emotional piece. I'm going to go in emergency medicine where the emotions are already set at a 9.8 out of 10
Yes.
and worried about how cases turn out. And it sounds like you like to ruminate and worry. And we're talking right out of vet school, correct? If I'm not
Yeah.
mistaken.
Yeah.
At any point, did you say, is this career not for me? I'll go back
Yes.
to nursing.
Yeah. No, 6 months in, I had just a slew of complicated cases and cases that didn't go the way that they should have gone. And I remember sitting in my hospital, and it was, the doctor's seats were right in the middle of the ICU, and everybody is moving around you. And I
Like the
remember,
pit, like the pit on HBO.
yeah, yeah.
Yep.
And I just remembered crying because I had a case that I had worked really, really hard on. It was a boy cat named Mermaid. I will still remember that cat. And the owners wanted to stop. They wanted to give up, despite the fact that we were making headway. And they said, "We're done." And I said, "Okay." And I
Because of money,
remember, I
money,
think it was a
emotion.
combination. I think it was a combination of money. I think it was a combination of logistics. Medicating a cat is hard. The cat had a couple of setbacks, and they're like, this is too hard, and so we need to stop. And I remember getting off the phone, putting my head down on the desk, and just sobbing.
Mm.
And because I said, "Do you want to come in to be present when we euthanize?" And they said no.
Mm.
And I just remember sobbing in those moments. And my mentor at the time said, "I can do this for you if you need me to, or you can do it."
Well, that's huge that your mentor would have done that,
Yeah,
because a lot of veterinarians that are quote unquote mentors don't want to get involved in high emotional stages like that.
yeah,
That you were blessed to have that.
yeah. And I remember afterwards just sitting there going, "What the hell why did I choose this? I can't sleep. I'm running these cases through my head, like, in San Antonio in the summertime, because of just like parvo runs rampant. I remember there was a day I had like 15 cases of parvo, and no one was going to treat.
Mm.
Um, all sorts of terrible things. And I was like, why did I do this to myself? And, again, I was surrounded by great mentors and great colleagues who are continue to be friends. And they were like, no one will fault you if you walk away from emergency medicine. You're good at it, but no one will fault you. And, that's kind of when I think I had shared with you, I read that book, How Doctors Think. And I think that was really helpful to realize that, we're not perfect in our thought processes. We make decisions based upon the information that we have at hand. And sometimes things go our way and sometimes they don't. And that I needed to focus on the things that I could control and make an impact on. And those areas that I can't, I needed to be able to learn how to walk away from it.
And it's funny you tell that story, because last time we talked off air, you said that 90% of this profession is about emotional control.
Mm-hmm.
Yet you were having a very hard time with that. How long did it take you to get emotional control? And do you think that's part of emergency medicine, to have that emotional control?
Um, I I think that it probably took me about 3 to 5 years to be able to recognize my own triggers and to recognize at least on the surface that sometimes that emotion and that anger and that grief and that worry is not something that I need to take on myself. Um, I do still struggle at times with, with those really terrible cases that, I'm worried about them. But I think it took me a good solid 3 to 5 years post graduation and having moved into my second emergency job to kind of really recognize that about myself. I still stand that, in ER medicine, especially ER medicine, or just kind of really high intensity cases, whether it's ER or surgery or, heaven forbid, oncology. I do think that most of it is like being able to recognize the emotions in the room, not react, but still be able to be present, but then be able to reset and walk out of that room and then move on to the next case.
So what that sounds like is you're compartmentalizing your emotions, right?
Mm-hmm.
You got to recollect and go to the next room, even though that room could have been just unbelievably hard to deal with.
Mm-hmm.
Is that a safety mechanism, or is that something we got to worry about?
I think that it's a safety mechanism for sure. I think being able to recognize that I can compartmentalize is key. I think for those folks that can't put a name to that's what they're doing. And my partner, he knows that. Like he knows that, hey, if I've had a bad day, or I'm working on some things and I'm stressed, when he calls, to check in at work, he's like, I can see it on your face, I can hear it in your voice. um, and whatever you want to share is fine. And if you need that, if you need that time to decompress, watch your trashy television shows, um, whatever we want to do, to be able to kind of come back down to center so that I don't bring all of that home.
And how long have you been doing emergency medicine? How many years?
This will be my 17th year.
And you're still bringing it home?
The certain cases, yeah. Certain cases,
Is it
that
worry, or is it thinking that you weren't perfect enough? Or was it something that the client did that upset you?
I think that it's a combination of things. I think that it's, um, you know, if the circumstances where, um, I will always struggle. I think even though I've seen a lot and I've done a lot, I still think that there's times when, was I the right person to help this family? And so I do struggle with imposter syndrome, like most people do. I worry about, if there was complications, is there something that I could have done differently? Could I have prepared the client better? And then those situations where, um, it was just truly a drain on the hospital, the staff. And not only am I regulating or trying to, be present for the emotions of a family who've lost their pet, and this is the worst day of their life, I'm now having to also, talk through that with my staff because they may not have had those resources of, okay, let's talk about this for a second. Um, we all worked really, really hard on that particular case. And I'm sure that they took things home and worried so how do we rectify how we feel in these moments? And thankfully at this particular point, I don't have as many cases that I bring
Mhm.
home. But I do still have them occasionally here and there, that just have me pause and, my blood pressure spikes or
Your cortisol levels go through the roof.
yeah,
Your epinephrine, I mean, your epinephrine's already flying because emergency can be so chaotic.
yeah.
But it's the cortisol effect. Do you have problems going to sleep at night?
Yes. I blame that sometimes too about my age group. That I struggle with some insomnia. I do know
But
that
it's because you're a
um
mom too, though. I
I
mean,
was gonna say,
you got to throw that in there because
yeah,
you're having these crazy days and
right.
an emergency, and you still have a job waiting for you when you get home.
Yeah, yeah. And I think that when I'm on swing shifts and I come home and I'm worse than probably a kid with pixie sticks at 2 a.m. and so I have to like decompress to be able to get myself into a position to be able to sleep, because otherwise I'll clean the house. I'll have all sorts of crafts and other things that I'm like, oh, 2 a.m. This makes the most sense.
Let me put together the photo journal online. I have
Right.
nothing else to do.
Yeah. Let's talk about my ADHD.
Yeah. Well, it's funny you say that. Do you think emergency veterinarians have a tendency to have ADHD?
Oh, 100%. So you were diagnosed when you were young. I was
And I love
diagnosed.
emergency medicine.
Oh yeah. I was diagnosed in the middle of the pandemic, when I was trying to study for my ABVP boards, and I
Mm.
was trying to also police COVID kindergarten, um, where I would hear my child at the end of the table and he'd have his hand in the air. And I'm like, why is your hand in the air? And he's like, I need her to call on me. Why? I didn't hear a question. And he's like, I got to tell her something. And I'm like, oh my God, bless teachers, because you are so distracting. And so eventually I had to move him into a room that I could close the door and put headphones on him because I was so distracted all of the time. And I couldn't function. And it was funny. And once I got my diagnosis and I was sharing it with my coworkers, people go, you didn't know this about yourself? And I was like, what do you mean? And they're like, we've known for years that you are very much in this subset of people with ADHD. Why do you think that you can do 10 things at once? And I was like, did I do 10 things at once? Well,
And
but
it's so funny you said that because that's where my question was going to go. What were you saying, by the way? No, just kidding. But that was what I was going to ask you, because I find myself, because of my ADHD, I am a multitasker.
Mhm.
I have no problem, and people think I'm crazy. People think I'm nuts, and I could be, but I can manage 6, 7, 8 big things in my head at one time.
Mhm.
But I could forget where I put my keys
Yeah.
or my wallet, right? Or that my wife told me to do something,
Mhm.
or that I was told to bring something to work and I totally
Yep.
forget it every single time, even though I remind myself.
Mhm.
But the big things I don't forget. Like, I don't
No.
forget that. And also, with that diagnosis, how do you think your memory is? Because I have a pretty photographic memory.
Yep. Me too. Yep. And I think
It
that's
pissed
why.
the hell out of my wife during vet school.
Oh,
Like,
a
I could
hundred
look at
percent.
anatomy one time and walk away.
Yep. I am a nerd with journals. I can read a journal and then be able to spout it off, or um or
But not the
I
bullshit, right? The important parts.
the important parts.
The
Exactly.
important parts,
Exactly.
exactly. I can scan a journal and know exactly what it was telling me and know how to implement it into
Yep.
practice.
Yep.
Yeah. Oh, good. We
Yeah.
share the same brain.
We do. We do. But yeah, no, that's what was helpful during vet school. And then the more times that I can tell you, I don't know if I can tell you their names any longer, but I can tell you if I've seen it once, I will remember it forever. So like
Exactly.
if I saw a specific case where you're like, got it, I can be able to, recall to memory what we did.
Yeah. I mean, like, I remember, perfect example. Yellow Lab was running around at the dog park. My associate was in there, and they ran it in on an emergency. It's sitting on the treatment room floor, and she's looking at it, not like, she's like, "Oh my gosh, the temperature's 106, oh 107, oh my gosh." I'm like, "It's mitochondrial dysfunction. Cool the dog off." And she came to me and she's like, "How the hell did you know that? Like, how do?" And I was like, "I saw it once."
Hmm.
And
Yeah.
and so that's a blessing. It's such a blessing to have. So I mean, I it is hard to deal with ADHD, especially when you're tired.
Yeah.
It gets really bad. But I also have trouble sleeping because of my ADHD. I have to have like a TV playing or something like that.
Hmm.
So my
Yeah.
wife kicks me out of the bed. She's like, "Get out of here," because start tossing and turning at night when it's quiet and dark.
Hmm.
I'm able to get up every morning at 3:30 in the morning and start doing stuff all day. And people think I'm just crazy, but I'm glad I'm not the only one who thinks that way.
Yeah.
I now have a study of n equals 2.
I don't even need, I use an alarm clock, but the same thing. 7 a.m. I'm
Yeah,
awake,
you're
ready to
good.
go.
Well, that's being a mom too, though. That's
Yeah.
being a mom because
Yeah.
you get yourself trained.
Yeah, very much so.
You love mentoring, so let's talk about these younger generations coming out. Is there anything that really scares you right now?
I think that, one of my big things that I'm scared with is I think that a lot of them aren't prepared. And I don't know what about it that they're not prepared. Whether or not it has something to do with, cases are down at the teaching hospitals, um, versus some of the distribution schools that are kind of farming kids out into the community. I think there is definitely a place for veterinary teaching schools and veterinary teaching hospitals for those really, really challenging cases, that no one has ever heard of before. But what I struggle with is the um, the everyday cases, the horses, if you will, not the zebras, but the horses. And so they're coming out into practice, and sometimes very, very busy practices, and they are unable to walk through a physical exam, identify things that are normal and not normal in a physical exam, and then how that translates to problem based medical records. um, I inter I have veterinary students from all parts of the country that come and will do externships with me, and many of them have never even been exposed to writing up medical records, which is unfortunately a good portion of our job. And they struggle with identifying the things that they need to identify, but then also how to look at a whole host of problems, narrow it down, and then be able to make a decision. So it's almost like they get the decision paralysis of, I don't know. But if you talk to them about some crazy, study, or, once in a lifetime sort of case that came in through their veterinary school, they'll tell you all about it, but then they can't help manage an ear infection or lameness or something that we see every day.
Well, I kind of think that's where veterinary schools don't get it right because they don't see those common everyday things.
Yeah.
So, I mean, that it is a strength that they get to work with these difficult cases and see, oh, well, 2, 3, 4, 5 different veterinarians have all had their hands on this case. They can't figure it out. But on the other hand, they don't see the anal gland abscess. They don't see the torn dew claw. They don't see the, otitis externa that has pus coming out of it. So it's a two-way. You could see it both ways. Do you think they're prepared for the soft skills that are required that you were discussing earlier?
No, I don't think so. I think that many of them, this is their first job.
Mm.
And so all of a sudden, all of the weight of the world is now on their shoulders, not only making financial decisions for a family, justifying diagnostics, justifying treatment, taking on all of the emotion that comes with a family and their pet, their sick pet, and then trying to be the leader in the room. So, if there's staffing drama, if there's not enough staff or not enough resources, how to kind of stand up and weather the storm. And so I do think that a lot of them struggle with their own time management and efficiency and how to be a doctor, how to be a professional. I think a lot of them will struggle with it because they haven't been exposed to it in the day to day.
And it's funny you bring up not enough doctors, not enough technicians, because because I sent it to you, one of the things I am looking at is moral injury.
Mm-hmm.
How many times, especially at your ER, do you feel like you've had to change the way you're supposed to do things, even though you know the right thing to do because there was a lack of staff?
Yeah. So our area that I currently live in has 6, I think, humongous emergency specialty, multi-specialty referral centers. And we manage probably a couple million people in this district area that I'm in. And very few, if not anyone, is ventilating cases, is having surgeons that are on call and willing to come in to cut certain things, have access to imaging. And you would think in an area as big as I'm in that there would be plenty of opportunities, but there's not. And so you end up having to change your focus and change your approach, so that you can still, get your answers, but you may not get them in the time frame, or you may not be able to refer clients in the time frame that you were taught to do so. And maybe studies are coming out that are different, and the way that we were trained might be not the right way, but until that's been proven to me, it definitely can be upsetting.
Well, there's a difference too between gold standard and standard of care. And I think we're starting to accept the standard of care model more
Mm-hmm.
in our profession, which is great.
Mm-hmm.
But even then, that could also be you got to change your standard because of the cost of care.
Yeah.
It's amazing to me when I was practicing a couple years back, the specialty hospital. I mean, we're surrounded by specialty hospitals here in Southern California, but I sent a hemoabdomen off to a specialty because I would have done it, but but the problem was I just didn't have the staff to do it. So I'm like, I'm not going to push this. But they wouldn't go in unless they did a CT of the chest and the belly prior. I mean, am I missing something?
Yeah.
Does it
And
really? I mean, if there's a hemo abdomen, I
it needs to be
understand the
cut.
chest film, maybe chest film's really quick, but why do you need a CT?
Yeah. And it's funny because those were a lot of that was a lot of the research and a lot of the things that I was taught from school, and they're changing that narrative now. And so some of the newer studies that are coming out are changing that. But you're absolutely right. You know, if it's already quite expensive and we are at the end of the day trying to help a family and help a patient, you know, is there really any benefit in being referred to a place that is going to repeat all those diagnostics?
Uh,
Um,
Oh, exactly. Oh, thank you.
drives me
Exactly.
nuts. Drives me
Drive
nuts.
me insane.
Yeah,
If the owner comes in with a blood panel that was just pulled an hour ago,
I don't
why?
need another one.
Maybe
Right.
maybe do an in-house, in-house PCV.
Hmm.
Maybe I can understand that. That's fine. But do
Hmm.
you have to run a full body chemistry again?
Right.
If you just, I don't know. If you just had an internal medicine person come in and do a full ultrasound on the belly and they found a liver mass and a splenic mass and you're sending them off, do you really need to repeat that ultrasound immediately?
Right.
Or can you say, you know what, we really need to do that? Because getting back to that hemo abdomen I sent, they ended up euthanizing the dog because it was so expensive. And it
Yep.
killed me because I was like, if I would have known that, get your
Right. You
ass
would have
back
just done
here.
it. Right.
I'll do it in a second.
Yeah.
Yeah, I think the moral distress of the profession is something that well, hopefully now we'll be looking more into because do you believe moral distress and burnout are two separate issues?
I do think that they're two separate issues. They are very aligned with one another, and I do think that one can lead to the other. Um, but I think that, you know, I think that we experience, especially, I would say in ER, and I would definitely say too, probably on the specialty side. I mean, I have friends that are in GP, and so I'm sure that they also experience moral distress. Um, but I think that we experience it every single day, every single day.
And
Um,
well, where I and I love Wendy Dean. I think she's brilliant. But where her and I just don't see eye to eye and she always pushes back is that, she's like, well, 30 to 40% of humans do not have health insurance. And I said, well, 93% of my patients don't. And every single appointment you see is a cost of care discussion.
mhm,
Every single
mhm.
one.
Yep.
And cost of care is not coming down.
No.
I read an article today, or crazy. I read it on Reddit, and I consider the source, but I heard they're closing down some Blue Pearl hospitals.
I I have been hearing that as well. And I don't I have been kind of watching I've been watching some of the forums and some of the boards to see if I can see, is it a specific group? I don't know if it's like the urgent cares. I'm not sure, but I saw the same thing.
Yeah, because Blue Pearl, I heard the one I read was Blue Pearl in Phoenix, and I'm
Jeez.
like, I'm like, there aren't that many specialty hospitals in Phoenix,
Right.
so what's going on? But I can tell you, Blue Pearl over VCA specialty is more expensive,
Even though they're the same company.
even though they're the same company.
Yeah.
So I don't know. I think the VCA urgent care model has failed.
Hmm.
So I think they're shutting most of those down. I really don't see those anywhere anymore. There are some, but they were all over the place because during COVID they were hopping, right?
Right.
But
Hmm.
because there were a lot of general practices that just were overwhelmed and couldn't see what needed to come in. But there are other hospitals that really limited to what they wanted to see because of the fear of COVID. And that's a whole nother discussion. But, panic medicine at its finest. But,
Yes.
I really think, there is a lot of things that need to be fixed.
Yeah.
Could you give me what is the top thing? If you ran veterinary medicine, what would you change?
I would make I would make pet insurance more affordable. I would make it more commonplace so that people were aware of it. And I know that there are a lot of companies that use it as a benefit. So not only are you getting health insurance for yourself, pet insurance is a benefit for a number of companies. I think that pet insurance companies need to have veterinarians that work for them so that when they are making decisions on declining care or whatever, it's coming from people who actually work in the business and not are just profiting off of the business. I think that there needs to be more pet insurance companies that are similar to Trupanion and Pumpkin, where they pay the vet hospital directly.
Thank
I
you for
know.
saying pumpkin. Thank you for saying pumpkin. I'm very impressed with Pumpkin.
Yeah.
They're a small player in the game, but they're going to gain some headway. And just stay tuned, because coming up on the Vet Trust platform, I'm going to be interviewing all the CEOs and everybody from everyone outside the veterinary profession that helps veterinary clinics. And I think pet insurance is on there. Lemonade's gotten in there. Some people have been very happy with Lemonade pet insurance. The problem with the big guy that has Peyton Manning as their spokesperson is that, number one, you got to wait a long time to get your money back. Number two, there's a great chance if you do not know how to write that receipt up, you're not going to get paid. Number three, veterinary offices do not want to get involved in any of that veterinary insurance paperwork. So there are a lot of clients that drop it because they're like, I didn't get paid. Where Pumpkin deposits the funds right into your checking account.
Yeah. Another company that I personal experience with is Assure. I got it through USAA. It's part of one of my multi discounts. So I have never used it for 7 years. And one of my cats decided that she needed to have a whole bunch of stuff done. And they deposited money in my account within 3 days of me uploading the receipts. They didn't even require medical records. They just wanted my receipts.
Yes, that is
Now,
amazing.
but I do think, even though I
But
know that it's
how did you get USAAs? Were you military? Someone's military.
ex-husband.
Ex-husband. Okay, there you go.
Yep. Yep.
Okay.
And so I kept it, and but yeah, I've been very pleased with it. And very
so you
pleased
got
with
a son out of it, and you got USAA. So you're already ahead of the game.
Yes. Yes. But I mean, I do recognize that it is a double-edged sword with, if we are getting ourselves involved with these pet insurance companies so that they will then pay us directly. But I look at the late 20-something-year-old, pet owner that has no children. They have a bunch of dogs, and all of a sudden they have a foreign body surgery, which is going to cost them at least 10 grand in my area.
I was about to say 10 grand. Yep.
Yep. And if you don't have that capability of putting it on your credit card, and you don't have the ability to do scratch pay or care credit or something else, that can be life or death sort of situation. So I do think that one of the big things that I would I would want is more and more pet insurance companies to take notice of Pumpkin and Trupanion and I guess Lemonade, to make it easier to access care. Because you're absolutely right. Things are not going to be changing anytime soon, with the cost of medications and the cost of everything.
Yeah, there's so many things I want to ask you. Oh my gosh, I could go on for 3 hours. And I want to be mindful of your time right now, but I can have you back and I can ask you
Of
more questions
course.
on that because you're still running it 17 years. You're still in the emergency room. You're still at the most costly part of veterinary medicine. Let's face it, is the
Yeah.
emergency room. And those are all things that I really want to try to hit home. But today, what I was trying to hit home, and the last question I have for you is, why do you think highly invested, high achieving veterinarians that have wanted this their whole life are the ones that psychologically break?
Whew. I think, I think that some of it is that it goes back to what we said in the very beginning. I don't think that we were prepared. And I also don't think that it was vocalized. I mean, I go back to my very first job and, I remember the bosses that I worked for, and I never saw the struggles that they were going through. I didn't see the divorces and the alcoholism and, um, you know, families falling apart and all of that. I didn't see that. And I don't know if it's that they didn't talk about it. But I think that when we are wired the way that we're wired to want to help and fix and take on the world and multitask at our 10 challenging things that are coming at us 100 miles an hour, I don't think anyone's ever said, why do we do this? Like, is there a better way? Because we keep doing it the same thing over and over and over again.
Wow, you just explained my dissertation. One of the theories I used was selection, attraction, and attraction, selection, attrition theory, which is we keep attracting the same types, we keep selecting the same types, and we're wondering why so many people are leaving.
Mm-hmm.
And it's definitely the definition of insanity. And
100%.
yeah, and I have no problem to say it proudly that I want to be a disruptor because I think things need to change. There are certain things we will be able to change. There's some things that we won't be able to. Obviously, when you talk about moral injury and the cost of care, making those euthanasia decisions, that's where pet insurance definitely comes into play, and that's why I love talking to pet insurance companies, because I'll do everything in my power to get pet insurance companies out in front of the pet owner better than what they are.
Mm-hmm.
But I want to thank you so much for being on today.
Mm-hmm.
Your ADHD and my ADHD brain thought that was like about a 6-hour interview.
Oh.
But I'm going to have you back on because
Yes.
you have you have a lot, because you come from the emergency standpoint, and that's where I think most of this moral distress comes into play, because the emotions are already heightened and the costs are already doubled, and you put those two together, you get a perfect storm.
Mm-hmm.
So
yeah, no, I'd be happy to come back.
Yay! Well, Christine, thank you so much for being here today. Stay on after this. And I still want to chat with you a little bit.
Yeah.
And to the audience out there, thank you for listening, and we'll see you next time here on our Irreplaceable Truths.